We all know the damaging effects the sun can have on your skin. Dr. Daria Marley-Kemp is a board-certified dermatologist and board-certified and fellowship-trained Mohs surgeon. She's here to tell us about the signs of skin cancer, how to prevent it, and what you should be looking for on your own skin. Dr. Marley-Kemp, thank you so much for being here. You know, we often hear about the A, B, C, D, E of skin cancer. Can you tell us what that even means?
Sure. So just to give a little background, skin cancer is the most common type of cancer in the United States and worldwide. The three most common types of skin cancer are basal cell, squamous cell, and melanoma. And actually 3.6 million basal cells and 1.8 million squamous cells are treated each year.
What, each year? Wow.
And although less common for melanoma, it is more aggressive and can spread to other parts of the body. So just last year in 2024, over 200,000 melanomas were discovered, and unfortunately 8,000 people died from melanoma.
Wow.
That's more than 1 per hour. So risks can be having more than 5 sunburns in a lifetime, and that can actually double your risk of developing a melanoma. But regular use of sunscreen can actually decrease your risk by 50%. And also, if detected early, the survival rate for melanoma approaches 99%.
Wow. Okay, that's at least some good news.
Yeah. So you talked about the ABCDEs of melanoma.
Yeah.
So A stands for asymmetry. What does that mean? If you were to take a lesion and divide it in half, are both sides mirror images of each other, or do they look different? B is for border. So the sides of the growth, are they regular or are they irregular, poorly defined? C is for color. Does it have various shades of color? Brown, black, blue, or red? D is for diameter, so is the size of the lesion greater than the size of a pencil eraser, although some melanomas can be smaller. And E is for evolving, so this is a growth that's maybe growing, bleeding, or changing, and I think this is the most useful one or the easiest one for patients to identify. Another is the ugly duckling sign, so this is one that doesn't look like the others, can be a spot that's growing, bleeding, changing, even itchy. And really, we just tell patients, if you're worried about a spot, please schedule an appointment with a board-certified dermatologist.
Can you talk about Mohs surgery and how effective that is when it comes to treating skin cancer?
Mohs surgery is an outpatient-based procedure that's done in the office, which means that I use a microscope to help identify and track the skin cancer roots. And doing this, it actually has the highest cure rate while preserving the most amount of normal tissue. And Mohs surgery actually has a 99% cure rate for most skin cancers. And Mohs surgery can also be used for treating some melanomas. We use special stains to help identify those melanoma cells.
Excellent. So there's hope out there. This is all, it's a little scary when you hear it, especially when you hear 5 sunburns a year.
Sure.
But then you're kind of giving us these solutions. So a little more comforting. Now, if someone is undergoing Mohs surgery, explain the preventative skincare measures that need to be followed before and after the surgery.
Great. So one thing is Mohs surgery is an office-based procedure. So this means that it's done under local anesthesia. So the patient is awake. They're able to then drive themselves to and from their appointment. Once the area is numb, then I remove the skin cancer tissue and use my microscope to help examine the tissue and make sure all the skin cancer roots are removed. During this time, the patient's able to wait in our office. They can read a book or look at their phone. And if any skin cancer tissue remains, then I take additional skin cells, but right in that area where those skin cancer cells remain. That tissue is then examined again, and it's tested, and this process continues until the site's cleared. That wound is then repaired or closed, oftentimes the very same day. So I tell patients, prepare for the surgery by having a good night rest, having a light breakfast, taking all their prescribed medications, including blood thinners, unless directed otherwise.
And Dr. Marley-Kemp, what is the difference between being board certified in dermatology and fellowship certified in Mohs surgery?
Sure. So board certified means that a doctor demonstrates that they've completed a 3-year dermatology residency and completed a written examination about various skin topics and their treatments. A fellowship-trained Mohs surgeon, in addition to completing and satisfying board certification requirements, means that they've done an additional year of training, extensive training actually, in Mohs surgery, skin cancer pathology, and surgical reconstruction techniques. And the American College of Mohs Surgery is the governing body for those fellowship programs.
And right now, I think you're going to take a look at my skin, right?
Sure thing.
All right.
So first thing whenever I do an examination with a patient, I always ask what brings them in to see me, if they have a particular spot of concern.
And I do, you know, I burn really easily, and I wear a sunscreen, and I wear high SPF, and I reapply, but I still burn if I'm in the sun. So I have a lot of moles, a lot of freckles, and I have like kind of a little like bump thing up here that I'm always
sure
concerned
thing.
about.
I'd be happy to take a
Sure,
look.
thank you.
So in doing the examination, I'm always thinking about the ABCDEs of melanoma and also thinking about that ugly duckling. Sometimes you may see us using a dermatoscope, which just is a special little light with a microscope or a magnification to help examine the area. So I'm going to take a look at one of the moles here.
Sure.
Okay, and I'm taking a look, and it has a nice even border, and the color is very uniform, so that looks healthy and normal. I'm going to take a look at this little mole here too, and same thing, nice even coloring, and that also looks healthy and normal.
Okay, good.
So I think everything so far on this arm looks great.
Excellent. Thank you so much, Dr. Marley Kemp, for taking a look. And that's something that we would go, you know, if we notice one of those abnormal borders or things like that, we'd go in the office and get our skin checked like you just did.
Exactly.
Excellent. Well, thank you so much, Dr. Marley Kemp, for being here with us today. Really nice to meet you. Thank you for sharing such great information. Dermatology Partners has convenient locations throughout the Mid-Atlantic. You can schedule your appointment today at dermpartners.com or call 888-818-DERM.